Hello, my name is Brittany Ham, and today we're going to talk about different calculations that you'll need for different IV infusions that you do in the clinical setting. So first, I just want to remind you of your different types of IV infusions, and this will be important as you decide, looking at a problem, what calculation you need to do. And it all depends on the order and how we're supposed to give the IV, so it's important to know this information. So first we can do a bolus. Now try to remind yourself what a bolus is. A bolus is a certain amount of medication that we're supposed to give, and it doesn't really relate to time. We're really supposed to be giving it as fast as possible or as fast as the medication allows. And so what happens is we don't worry so much about time. This isn't an order that's given over X amount of hours or anything like that. We just give it as quickly as possible. But we care about how much med the patient receives, and that's usually how the order is based. Such as an example here. We need to give 8,000 units of heparin as a bolus or stat as quickly as we can, and it doesn't relate to over the course of time. And we often don't use a pump for this, we often use gravity. So we're not worried about trying to figure out what number we need to program our pump. The next type of infusion that we think of is a finite infusion. So what this means is I call this start-stop. I know when my infusion is supposed to begin, I know when my infusion is supposed to end. And so my patient is going to get the entire thing. I'm going to give it all, and it's supposed to take a certain amount of time. And so really, let's take the example of 1,000 milliliters of normal saline. So I know I'm supposed to give the complete 1,000 milliliters. I know it's supposed to, in this case, take 8 hours. And so I can see exactly how much per hour I'm supposed to give my client and program my pump accordingly in order to do that. We also can think of an IV push. So this is usually given in a syringe. We stand at the bedside, we give this manually. And some medications have a certain amount of time that this should take. We can't push it too quickly and we can't push it too slowly in order for the medicine to be effective. So in this example, we could give 10 milligrams of morphine at the bedside and push it over 2 minutes. So then I can think about, well, how much should I be giving in 1 minute in order to stay on pace for my 2 minutes to have the whole thing completed in that time. The final type of infusion that we talk about is continuous. So this is an infusion that doesn't have a start-stop. It's just going on and on and on until we change it based on the patient's condition. For example, in this case, I know the solution that I'm using is 750 milliliters of D5W, and it has 250 milligrams of nipride in it. But I don't know how long my patient's going to need this. As far as I know, this is going to go on and on and on until I change it, make it a different rate, or it's ordered to be stopped. So I'm not going to be computing my hourly rate in the same way that I do for a start-stop or a finite infusion. It's actually going to be based on my patient's condition, and I'm going to increase it if my patient needs more of the medication, and I'm going to decrease the rate of the infusion if my patient needs less of the medication. Right now, we're just going to focus on the first two types, a bolus and a finite medication. Continuous is a little bit more complicated, so we're going to tackle that part of it last.